Yes, Nisambula Vinaka, thank you so much for joining us once more to our series on oral health and overall health. The health of the mouth is important to maintain good health for the rest of the body.
Right.
And thank you for joining us. We trust that sharing now will help us realize that the health of the mouth here is important in maintaining overall health. Okay, thank you again for joining us, and we welcome our guest, Dr. Numaya. Doc, my jointing
Thank you.
at the studio. And we were just recently looking at oral health and diabetes, and how we can help, reduce that, especially the blood sugar. Now we're looking at another part of the body, which is the kidney. Oral health and kidney diseases. Okay, so the kidney disease oral health will help. So let's go through this episode and see what is it that we can do. Okay, so today we are looking at that important part of the body. And when we think about the kidney, Doc, we often think about water, salt, or blood pressure.
All right.
Okay, but not usually the mouth.
True.
Okay, so what can you tell us about it as a dentist?
But remember this, water or salt, they enter the body through the
mouth.
Through the mouth. So it's very important that we have to see from the common factor approach.
Okay.
To deal with the kidneys, you have to deal with the mouth issues.
Okay.
So when we think about yet research now shows what's happening in the mouth,
especially
the gum disease, can directly impact kidney function. Okay, so we try and switch it to the positive notion. When there is healthy gums, we can also say there is healthy kidneys.
Okay, so let's try and have a look at the kidney, understanding the kidney. Let's begin with the basics. Okay, what do the kidney do?
The kidneys filter waste and excess fluids from the blood. Okay. See now?
Okay.
Blood, and when we see urine, there's no blood. But remember the wonderful mechanism of these organs. Kidneys filter waste and excess fluids from the blood. They also help regulate blood pressure, red blood cell production, and electrolyte balance.
Okay. So they are like the body cleansing stations.
Exactly. Yeah. See, one thing, we Fijians, we have to understand how our body works. We don't really need to go first to the disease and the abnormals. We have to know about the normals and the wellness and everything first. Because when something is not on, which is we can easily figure it out. Yeah. So now we see that our kidneys, they are like our body's cleansing stations. But if someone has chronic kidney disease, that is not. That's sad situation. Yeah.
They can do their job. They can filter the toxins.
Yeah. The body can't filter toxins well, and leading to complications that include issues in the mouth.
Yeah, so, I'm just, while we were talking, I'm just thinking back of, while attending Avondale College, I was there with
kidney patient,
a colleague from Bougainville in Papua New Guinea. He was very diabetic and he was on kidney dialysis. And
hard time, eh?
And one day, I did not know this, so one day I went and got an extra serve of ice cream and brought it to him. I said, my brother, here, have some. I noticed you haven't been, he was staying away, abstaining, because he knew that
his condition.
He knew his condition. And he looked at me, he smiled, and but I brought him a very big serving. So, out of respect, he accepted and he took some. He disappeared. He went and gave that to, but that little that he took caused him to be sick the next day. He was not well the next day. And I felt so guilty, up to this day. I felt really bad because I didn't know. So I went and visited him and apologized. This means that you and I need to understand the
how
situation,
our body works,
conditions, and what diabetes, kidney diseases, how it affects the person.
Yes.
And we should understand. Many times, when people, especially as Fijians, kana, go, totally. And then we start serving more and more. And we need to remember
our
that
system
maybe
is
that person
overloaded.
System is overloaded, and let's not force people to eat. I'm one person that always, like you're thinking, I'm trying to take care of my friends here. Let them eat more. But I think just serving enough is adequate. It's enough.
True.
Let's not force people
to lead to
once they say thank you, let's stop there. Okay. So, let's, you've given us some, the kidneys, job there. They filter waste and excess fluids from the blood and help regulate blood pressure. That's important.
Very important.
Okay. So they are like body cleansing stations. You've done that. Okay. So, let's have a look at oral problems in the kidney patients. Okay, so what mouth problem do kidney patients face?
Okay, kidney patients, they have one oral health problem they face is dry mouth. Like always tend to have this dryness in the mouth, and then always leads to wanting to drink water. But unfortunately, some take juice again, which further aggravates the dryness of the mouth. And dry mouth is very common due to medications or fluid restrictions. Even some of the medications that we take, prescribed medications, they have alcohol and certain percentage, and alcohol tends also to dry the mouth. And that increases the risk of cavities and infections. You see, in our mouth, it's always be moist. Not moistened by, but should be moistened by the saliva. And water is a very good fluid that moisturizes the mouth, because water and saliva are just like compatible. They just work together, and and having this dry mouth, and then we tend to drink sugary drinks and all this.
Worsens the situation.
It worsens the situations, and then that increases the risk of cavities, or that's tooth decay and infections.
Cavity is the hole in the tooth.
The hole in the tooth. Because the tooth should always be moist with saliva and also the overall structures of the mouth.
Okay. Now, how about the gum disease?
Well, as we have said, that people with kidney disease often have more severe periodontal disease. So now we've jumped now from gingivitis, which is the first signs of gum disease, and now it's the periodontal disease, and this of the gum, periodontal, and this affects the connections between the gums and the teeth and the bones. So people with kidney disease often have more severe periodontal disease.
That's the inflammation of the
gums, but more deeper than the gingivitis. Their immune system is weakened. You see now the overall condition. The immune system is weakened and the inflammation is higher. We see how things work together.
How about if they're on dialysis?
We know the dialysis, like this tertiary care given. They are even at a greater risk.
So those who go for dialysis must remember that they are at a greater risk. Control their intake of sugary sweets diet and watch the mouth, the gum.
Right.
Because once that gum is infected,
very true. Because when gums are infected, there's toxins released by the bacteria, the microbiome, and then they further contribute to unhealthy blood. And uremic toxins can cause bad breath, mouth ulcers, metallic taste. Sometimes we feel our like taste in the mouth. Yeah, metallic taste. And sometimes for this breath, sometimes this fruity smell breath.
Like somebody chewing gum.
Yeah, right. Those are some of the things that happen. And some even develop bone loss in the jaw. Yeah. No, when there's, sometimes the jaw, this bone resorption, bone loss, and the people with loose teeth, because there's certain percentage of bone loss, because tooth should be stable in the jaws. But if there is problem, then they become loose because of the weakened tissues or the structures around the teeth.
Just talking about that, Doc, I remember when I was up in, I went to teach in Nankarawai for a couple of years. This is up in the inland of Namusi.
Right.
No roads that time when I went up, when I was up there. And I got fish poisoning once. Very bad poisoning. Where my gum was weakened.
Right.
And my teeth here, a set of teeth, I could push these ones down and push them back. The gum was just so weak. Yeah, and when I went to the hospital, every day they had to apply some black cream. Yeah. What would
for that time? In that time,
Yeah, that time they had to apply that.
Right.
Yeah, my gums down here and up there, and I was just resting for a full week. But that was from fish poisoning.
How it affects
our
gums right to our tissues.
Right to the tissues, So we just need to be careful with what we eat. Sometimes our desire to eat food that brings us sickness can lead to a lot of complications.
It's very important that we should choose well what we eat. Sometimes we know that certain foods will give us problem, but we just go ahead and and then we say, then I will
danger.
I'll accept the danger, but we should be watch out.
Okay, so does poor oral health make kidney problem worse too? No?
Yes, chronic gum disease releases bacteria and inflammation into the bloodstream. You see, nothing happens in isolation because our system is many parts, one body. So chronic is something that is ongoing. Chronic gum disease releases bacteria and inflammation into the bloodstream. This puts extra pressure on already struggling kidneys.
Already struggling kidney.
Because kidneys has been trying to do its filtration and its production of this and this, and then we are burdening it again, and then it breaks down.
So that is why sometimes these people have to they have to inject themselves with insulin. Same kidney people. Huh?
Yeah, the kidney.
So to help
kidney dialysis. When there is.
Okay, so it's a cycle of damage if we don't intervene. Okay,
yes.
So
and when we will intervene, that's the question now for Fiji. When we will intervene, are we going to build more kidney dialysis centers?
We need to watch our.
We need to be very. Really.
Our education. Our
prevention.
Education system is a good place to begin the training.
Yes.
So we really need to take action in our schools. Make sure that dental health is emphasized.
And overall health. This topic needs to be there.
So the homes must step in, start teaching your kids how to eat healthy, how to maintain good oral health by teaching their children to brush correctly, brush every day, twice a day.
Eat healthy, drink healthy.
So that's the only way to counter this.
Live healthy. Yeah. Very true.
Okay, so the poor
it's a cycle of damage that that if we don't intervene,
Okay, so it's a cycle of damage if we don't intervene. That's why oral care should be part of the kidney disease management.
Very true.
Okay, so let's have a look at prevention and support. How can we help prevent complications in the mouth for kidney patients?
Okay, prevention is always better than cure. And I think in this situation, Fiji, now we need to take action. We have to prevent, thinking of preventing complications, but we have to really prevent not only complications, because it's already in the system of disease. We want to prevent the onset of kidney disease, and we want to prevent the onset of diabetes. We have to be more strong and more aggressive in this now. And in this question, as you have asked, how can we help prevent complications? To me, this preventing complications is late. Because we already allow it to happen, and then when it's starting to complicate, then we try to,
So if we start now training children, going to schools, just, the schools, just attending to the educating our young children and the homes and the family.
Very true.
Start teaching
Put
now.
it into the system.
We try and build a good generation, future generation.
Very true. Otherwise, this couch, that is Scouting Fiji, I don't know when we are going to intervene in a very... preventing complications in the mouth for kidney patients. Use non-alcohol mouthwash to avoid dry mouths. And for that, it's just the best is that maintain regular brushing and tooth flossing regime. We should take a stronger approach towards oral health care. If we have been doing toothbrushing and flossing, but now we need a stronger approach.
So we need to stay hydrated within safe limits of the condition. The one with the kidney issue should stay hydrated within safe limits for their condition. What do you say to that?
Yes, and attend both dental and kidney care appointments. Dental appointments, kidney care appointments. I think now we should be having a more
aggressive way.
Robust system of information of prevention. And now
rather than cure.
Rather than cure.
For their kidney treatment, they should also go for their oral.
Attend both dental and kidney care appointments. The two systems must be treated together. Otherwise we're saying, okay, we're looking at the feet, or we're looking at the kidneys, and they're having this kidney dialysis, and the ravagings in the mouth.
True.
Because what we eat and drink and what we breathe, they affects the whole body systems.
That's important. When you go for your dialysis or you go for your treatment for your kidney, remember to also take time. At that same time, go for your dental treatment as well, the dental care.
Right. True.
Okay, let's have a look at the Bible for a minute. Psalms 51:10 tells us, this is David's prayer, create in me a clean heart, O God. Create in me a clean heart, O God. We can also ask God to help us maintain clean, pure bodies, mouth included. This is where everything starts off in the mouth.
Right.
Okay, so let's have a look at the questions. Doc, just to look back and reflect. Do you know anyone with kidney disease? Fiji, this is also an issue. We have a lot of people that are
and then we're having kidney dialysis center in the cities.
So they definitely will have experienced mouth problem as well. What simple steps we can do to protect mouth and kidney patients?
Okay, first of all, the simple steps, Fijians, we need to be using soft toothbrush.
We cannot overemphasize that.
We can.
Toothbrushing is important.
Toothbrushing is very important. At least 2 times in a day, and make sure that we brush before we go to sleep and in the morning. And it's very important to brush before we sleep because we need to keep this microbiome or the bacteria stay. If we don't brush, then we are just trying to promote their
the job of those
Yes.
bacteria.
Yes, very
Yeah,
true.
you know, we are talking about people in the city, in the towns, in areas where shops are readily available. You can always buy your soft toothbrush.
Yes.
In the village, we have plants that are there. You can go and
Yes,
get
yes.
a branch
Yes.
and soften the one end of
edge.
it and use it for toothbrush, and then open it and get them in strips, and you can
For flossing,
use
yeah?
that for flossing.
Amen.
Yeah,
That's
okay,
a very
so,
natural way.
you know,
Yes. And
do
the one
that.
thing to avoid is using the soft toothbrushes and drink water. Yeah.
Yeah.
And regular dental visits.
Okay.
And gentle hygiene. Yeah?
So, can oral infection lead to more severe illness in kidney patients, I don't?
Yes, especially systemic infections. Yes. It also raises the inflammation levels, and it can complicate dialysis or surgery.
Okay. So how can
it's very important that we maintain a healthy lifestyle and a healthy body system. Because when we get sick, when we go for treatment, it's easy because we don't have other issues like diabetes or high blood pressure or kidney, because those conditions, they tend to block treatments that
should be given.
should be given straight away. Yeah.
Okay.
Yeah, that's why it's very important.
In our communities, how can we encourage, community support to those with kidney issues?
Encourage spiritual support and prayer.
Yeah. So in our local churches, we do have people that have kidney
spiritual
issues.
support and
Please
care.
be close to them, be near them, encourage them.
True.
And help them with oral health, and pray for them, pray with them.
Right, true.
Give that spiritual support.
And organize health screenings and talks. Information, real information, factual information, information that can turn into a behavioral change, or information that we can do. Not just highly colorful information, then people don't know what is meant.
We have our local, our, not local, but our country, our churches.
Yes.
They call for their big camp meetings. Why not have, during those meetings where all the members come in, why not have a booth where they can go and
learn about themselves?
They go and have all these things checked.
True.
So I know the Fiji Mission is calling a big boss soon.
Yes.
I believe the Methodist Church is having this.
Right now.
Why not include this in their planning?
I think it's very important that as a nation, when we have gatherings, small gatherings or big gatherings, that we should be teaching Fijians about their anatomy and physiology. That is how their body is structured and how the body is the functions of them. Because when we know normal or wellness, then when illness strike, we know that illness is there.
We can counter it.
We can counter it. And if we don't know the normal, first of all, when the abnormal comes in,
you're stuck, you're lost.
We're lost. So that's why I think it's very important that we organize health screenings and talks and to help the country.
Yeah, okay. Just as we close, Doc, would you like to just read for us Proverbs 17:22 and what it says?
Proverbs 17:22 says, "A cheerful heart is good medicine, but a crushed spirit dries up the bones."
Crushed spirit dries up the bones, and bones, the bone marrow, that's the factory for blood cells.
Yes.
Yeah, so let's look after our body.
And and a cheerful heart is good medicine. Good words and encouraging words, or words that bring us wisdom and lights up our mind, not darkens our mind. Then
in other words, let's be happy.
Let's be happy. Right.
Whether in the workplace or whether at home or on the bus, wherever. Let's have happiness.
That's a bulla virus, bulla happiness. Okay, oral pain can crush the spirit. Let's relieve suffering
where we can.
where we can.
Yeah, okay. Relieve suffering by being joyful. Be a person that brings happiness around you.
True.
Okay, so let's have a look at James 2:16, and it reminds us not to say, be warm and well fed without action.
We need action.
Let's care for both the heart and the mouth in word and deed.
Very true.
Yeah, okay, so be warm and well fed.
When you give a very good advice or do something good, it helps the whole body. Helps the kidney, helps the heart, even helps the status of the blood.
Yeah.
Helps the bone marrow.
So that's very important, and thank you for joining us. And do remember to contact us on toll-free number 813 if you have comments or any question, or if you need to be prayed for. And to those of you that are suffering with kidney illness, remember, you're not alone. We are here to support you, and your community should be supporting you as well. In our next episode, we will be looking at oral health and the immune system. So that would be very interesting as well. And until then, we are now saying goodbye to you. Isa Mwathe.
Mwathe.